All right. Hi, class. This is Group Indigo. It consists of me, Bianca Polito, Rachel Pizzo, Danielle Ocampo, Evelyn Rubio, and Sabrina Sandoval. In this presentation, we will be discussing health promotion, focusing on the topic of nutrition. We will be covering issues such as why health promotion matters, the nurse's role in health promotion, barriers to health, nursing standards pertaining to health promotion, QSIN competencies, and AACN essentials. All right, on to the next slide. So why does this matter? It matters because this is something that a majority of Americans struggle with. According to the CDC, approximately 42.4% of adults are obese, and this is a staggering statistic, but it's the reality we must face. In order to bring up this topic to our patients, we must ask them about their diet, and the word diet is something that is often misunderstood. Due to the misinterpretation of the word, it is a major health determinant. When patients think of the word diet, they feel as if they must greatly restrict their caloric intake, but that is not the case. Due to this discrepancy, patients will continue eating as they do and make no adjustments. As nurses, we understand that a poor diet is linked to increased risk of diabetes, cancer, and heart disease. In order to put an end to this vicious cycle, we must assess our patient and understand where they are coming from in terms of health literacy and what barriers they face. And this leads us to our next slide on health literacy.
So why is literacy important? Well, understanding nutrition at a macronutrient level is imperative for preventing type 2 diabetes and decreasing the risk of cardiovascular disease. It is often recommended for shoppers to shop around the perimeter of the store in order to avoid processed foods. But the fact of the matter is that our patients are going to continue to eat junk food even though they know it's not good for them. So provide them with the knowledge base that gives them the tools to read nutritional labels and understand why they're important, they're more likely to implement this practice into their shopping habits. The nurse must educate patients to understand nutritional labels in order to not be fooled by misleading claims and misleading pictures on food packaging. Claims of calorie count should be critically analyzed by reading the nutritional label. It is important to understand what a serving size actually looks like. If a product claims it only has 120 calories per serving, but the package has 2 or 3 servings, this claim can easily fool an unsuspecting shopper. For this reason, patients must be able to identify how many servings are in a container. For example, a 16-ounce bottle of Coke contains 2 servings per bottle, and who among us hasn't consumed a 16-ounce bottle of Coke? Patients must understand that while a label may list added sugars, every gram of carbohydrate consumed is broken down into sugar by the body and used for energy. Total carbohydrate intake matters. Finally, patients should learn to identify foods high in saturated fats because saturated fats contribute to the increased incidence of cardiovascular disease. Next, we'll be talking about professional nursing roles. Nurses work in healthcare facilities, in community centers, and schools. These nurses can prevent illness and disease among the people who live in our communities by nutritional screening, referral, and providing nutritional education. Home nurses assist the community by continuing care outside of the hospital, which ensures that the facilities may concentrate more on the dietary needs for nutrient intake and support of patient recovering from medical conditions. In contrast, community nurses focus more on prevention. The clinical nurse educator promotes healthy eating by educating either nursing students or other nurses about nutrition, and public health nurses are community health educators who work at community centers and schools, continuing the prescribed health and nutrition regimen. Next, Rachel will talk to us about barriers.
Thank you. There are many barriers to health promotion. Barriers to supporting nutrition and health education include educational disparities, such as the unequal distribution of health resources. These resources may consist of lack of school funding, experienced educators, learning material, and technologies, leaving these communities in concentrated poverty at a disadvantage. Wolfson, Ramsing, Richardson, and Palmer 2019 stated that individuals who are less educated and earn a low income under $25,000 were associated with poor eating behaviors. such as the inability to cook a healthy meal. These individuals complained of lack of time, inability to access healthy foods, and healthy foods costing too much money. The next slide I'm going to discuss is the nursing's impact of health promotion. Nurses that work in the healthcare facilities and public health prevent, identify, and treat malnourishment for the promotion of healing, nutritional support, and physical well-being. By educating students on eating healthy and how each food group affects the body, school nurses promote health, thus reducing potential or managing actual health diseases such as cardiovascular disease, stroke, type 2 diabetes, and cancers. For instance, large amounts of carbohydrate intake may lead to type 2 diabetes. Next up, we have Sabrina Sandoval discussing nursing standards of practice and code of ethics.
So the Nursing Code of Ethics lists the primary goals, values, and obligations of the profession. Provision 3 states, the nurse promotes, advocates for, and protects the rights, health, and safety of the patients. Provision 5 states, the nurse owes the same duties to self as to others, including the responsibility to promote health and safety, preserve wholeness of character and integrity, maintain competence, and continue personal and professional growth. The two Houston competencies that we found applicable to our topic are patient-centered care and teamwork and collaboration. So regarding patient-centered care, we have to partner with the patient to create a plan that includes the patient's food preferences. We should recognize the patient's unique views in relationship with food and how cultural, ethnic, and social backgrounds influence food preference. As we mentioned earlier, socioeconomic status impacts access to food and ability to pay for food. And we must identify the patient's personal barriers and collaborate with him or her to plan tangible nutrition goals. Regarding teamwork and collaboration, we must work with the doctor or registered dietitian to reinforce education regarding the recommended or prescribed diet. And next we have Evelyn.
The AACN Essentials established the framework of what needs to be included in nursing education programs. In the baccalaureate program, it touches upon health promotion in two essentials, 7 and 9. Essential 9 reflects on including prevention and population health into the curriculum. This includes being able to improve population health by assessing, implementing, and evaluating. Epidemiological studies have found that lifestyle, environmental, and genetic factors are the major determinants of health, and that caring alone for the disease isn't sufficient to promote positive patient outcomes. It is essential to prioritize primary prevention methods to be able to increase health throughout the lifespan of a person, which is why including nurses in this is so important. Essential 9 touches on being able to integrate identification and prevention with EVP during practice. It also indicates that the professional nurse will be knowledgeable enough that she needs to know that she will need to be able to educate herself for lifelong health promotion. We want to thank you for watching our presentation.